So my name is Maureen Taylor, and I'm in Toronto. I live in Toronto, and I'm a physician assistant who works in infectious diseases.
I'm based in Bangalore, and Bangalore is like a city in southern part of India. It's around the size of New York City. And I'm an intern doctor, which means I'm in my first year of being a doctor.
So my background is I'm a physician in the UK NHS, and I last saw a patient over 4 years ago now.
So initially, those patients in March were the travelers. We got it from a lot of different places.
They'd actually physically reconfigured all of the wards. And that's the thing that really brought it home to me, was it kind of felt like going into a wartime hospital. That was the first time in my career I'd ever faced that much of the unknown.
There were like really strict lockdowns happening. It just felt like we were overstaffed and, we were just waiting for something to happen. And initially for a while, nothing happened. So a number of patients who had nothing, who didn't really require a lot of clinical management. That's basically most of the patients in April and May. And suddenly the scenarios completely changed.
Initially, people were young. They were fairly well off socioeconomically because they had traveled. Then gradually, those people got better and went home. And what we saw instead were people who worked on the front line. They were essential workers, grocery stores, factories, food handlers who had to go to work. Often they were immigrants who didn't speak great English. And it was actually them and their older parents who lived with them that I started to see.
In a country like India, where you have a lot of diseases running around, you have a huge population completely depending on these hospitals. There was kind of a vacuum where, patients got really sick with other things, but didn't really have a hospital to go to because, the major public hospitals were all converted into COVID exclusive ones.
You have these moments where you realize how severe it is. Like when I was right in the middle of London, and there was at noon on the first day that I was going into the hospital, there was no one there. There were no cars. There was nothing.
Finally, it did come to Bangalore. We initially started seeing, small numbers, and suddenly it just went from maybe like 200 cases a day, it just jumped to 2,500. And then it just kept going up. Everyone's on oxygen. A lot of people are intubated. A lot of people are in the ICU. People are dying.
Most of the patients died. Everybody was, they'd increased the capacity of ITU by about threefold. So there were just patients everywhere. And these guys are still quite traumatized by this.
And these people, I'll never forget them. They got COVID from their son, who was an essential worker. He lived with them. His father in the ICU died. His mother was in the same hospital, but on another floor. We couldn't take her because she had COVID through the hospital down to see him. So she had to be told that he was dead, and she hadn't been able to say goodbye. I sat there with her because I'm a widow too. My husband died, but I could connect with her on that level. And so we just sat, and I said, tell me about him. Tell me about your marriage. Tell me about the life you two had together. And she cried and talked about him.
There are young people dying in beds in the ICU that we see. And the people who suffer the most, the people who are not able to cough up the money for private hospitals.
There was one very old man who'd beaten the odds by escaping intensive care. He'd been ventilated for 5 or 6 weeks. His lungs were just in such a terrible state, and basically he'd got better apart from his lungs, and he was fine sitting in his bed, but he couldn't move. He couldn't take 2 steps off his bed because his lungs were just so damaged. And my immediate thought was, we're going to have this huge problem with people with chronic lung damage. He's probably not going to be independent at all for the rest of his life.
I will never forget my patient who died on my watch with COVID, the first one. He was an airport limousine driver. He was an older gentleman, and he didn't have a lot of family. He struggled so much to breathe, but he did not want to be intubated and die in the ICU. So we didn't send him. And he got worse and worse and worse. And we just tried to make him comfortable. We actually involved our palliative care team to try to give him sort of palliative care at the end to keep him from feeling the effects of not being able to breathe. It's so hard.
Another thing that I noticed was a lot of doctors have died in India. This is by the Indian Medical Association, the equivalent of the AMA in India. and they said 382 doctors, just doctors, not healthcare workers, just doctors have died in India over the past few months. And the youngest doctor to die was 27.
The really tough thing was that relatives weren't allowed in, so these patients were dying on their own in side rooms. These people with relatively young families were dying on their own, with their families saying goodbye to them on iPad. And when you become quite hardened as you go through your medical career, but I found that really very tough, actually. And I know people who'd seen that a lot more than me. Had huge problems psychologically dealing with that as a human being who happens to be a doctor.
And India is still the only country where we're having around 80,000 new cases per day, which are being reported, still going up. The problem is that now, there is obviously no lockdown anymore.
It looks like the numbers of cases are going up again in the UK as they are in Europe. It looks like the demographic is different this time. It's mostly younger patients. And of course, we're testing more aggressively. So we're catching people that we wouldn't have diagnosed in the first wave.
Our numbers in Toronto, unfortunately, are going back up again as restaurants and gyms and churches have reopened.
So even though cases are going up, patients are dying, at least doctors and healthcare workers, they are trying their best. And my heart really goes out to them, to the people in the rural areas where there is a dearth of PPE, there's a dearth of good care, who are doing their best for the patients there.
We know that we may have to shut down some schools again. Hopefully it won't be widespread. We can target them. Some businesses may have to shut down again. We can target them. So we know all of that. The question is there fatigue? Are Canadians sick of the lockdowns, sick of the closures, sick of being without work, because there are lots of unemployed people up here as well. And it's obvious that the fatigue has set in. And I just don't know if we'll be able to flatten our curve again, which we did so well in the summer.
Bangalore is like a really urban area in India compared to other places. And from what I hear in other places around India where cases haven't reached the level of Bangalore, but they still are high, there is still a shortage of PPE. There are still people who can't get proper N95 masks.
I never felt like a hero because a lot of people had to go to work, right? And I felt that I was better off than many of them because I had good personal protective equipment to keep me safe, and many others didn't. But there's no question that we're exhausted and we're frustrated that we have to deal with a second wave, where we feel that with some smarter decisions on the part of maybe our government and colleagues and other people in society, maybe we wouldn't have had to have a second wave. But it is what it is, and I'm going to go do my job tomorrow and the next day and the next day.